Hi, my name is Amani Behrens, and I am a third-year dental student at Case Western School of Dental Medicine in Cleveland, Ohio. I'm here to talk about more about the Case Western program, and again, feel free to ask me any questions to get to kind of get more detail since I'm going to give a kind of brief synopsis of the program. So, Case Western is located in Cleveland, Ohio, and recently, as of 2 years ago, we actually kind of built a whole new building, also a whole new clinic 5 minutes away from our old campus, and it is brand new and it is ready, it is functioning, and it is amazing. Definitely an upgrade. There are two buildings. So the first one is the health education campus. We actually combined all of our health professional programs under one building. So in one big building, we have the dental school, the medical school, the physician assistant school, and the nursing school. And we also have our own separate dental clinic across the street that's just for dental students. So it's such an awesome, upgrade that we've gotten, and definitely go online and Google it and kind of get a virtual tour of it. It's definitely breathtaking. So this is a 4-year program, just like all the other dental schools. D1 and D2 year are heavily didactic, and D3 and D4 are heavily clinical. But the most unique thing about Case Western's program, and my personal favorite thing, is that we actually get to start clinical work our first year. So in the near winter break time of our first year, literally like 3 months into your dental school career, we're already getting on buses and heading over to elementary schools to put sealants on kids' teeth. That's the first time you ever get to interact with patients, and it's super fun, and we get taught what to do, and they ease us into it. After winter break is over of your first year, you're actually in the clinic every Friday doing cleanings on patients, which is awesome to kind of get that patient interaction, really early on, and kind of getting familiar with the clinical setting and the computer software and stuff like that. So I'm really, one of the biggest things about Case Western that is very unique is early clinical exposure, which is super important to look for when you're looking for a dental school. So D1 and D2 year, it's mainly didactic. All of the lectures are PowerPoint based. How we study is from PowerPoints as well, which is super awesome. We also do preclinical work in the simulation clinic. So we do drilling. We do, operative drilling, which are cavity preps. We do crown preps as well. We do aesthetic cases, kind of a little bit of aesthetic cases. We do an implant tutorial as well. We do waxing, which is big, and we do that mainly in the preclinic. And then D3 and D4 is just mainly clinic. You are a student doctor. You are fully in the clinic from 10 to 5. 8 to 10 are morning classes, and then 10 to 5 is clinic. In clinic, we do basically everything under the sun that is not too complicated. We do operative work, we do cavity fillings, we do crown preps, we do dentures, and we also do extractions as well. So every single activity has requirements, and we have 2 years to complete those requirements. And Case Western's known to, to kind of expect a lot of work from us, which is awesome because we do want to get as much experiences as we can before we go out into the real world. And we don't seek our own patients. They actually give patients to us. Our patients are passed down from our bigs. So once you are first year, you get assigned a dental student who is 2 years younger than you, or 2 years older than you, I'm sorry. So then once they graduate, their patient roster gets transferred to you. So you are basically, you're not left dry. You have a patient roster to work with. So there's no stress on your end to kind of recruit your own patients. We have the patients for you. And yeah, my favorite thing about the program as well is that everyone's willing to help you, especially if you don't know them on a personal level. I feel I can go to any stranger and just ask them how to do something simple as, waxing, or their favorite technique on how to do a class 2 filling. Like, they will come up with an answer even if they don't know you as well. And I really appreciate, they can drop everything to help you, even sit next to you and assist you during a procedure. So yeah, and also the faculty are very supportive for you, and especially our preceptors as well. They're a bundle of knowledge. So they're easy to walk up to and ask questions. And yeah, so I think, that's kind of a really brief synopsis, but I also did a video on YouTube as well about, more of the program. So if you want to just search my name up in YouTube, I have more information about Case Western in that video, or you can email me if you have any other questions. Well, best of luck to your guys' journey, and let me know if you have any questions. Take care.